All right, it's my pleasure to introduce a couple of experts, one new expert that you're going to hear from and an expert that you've already heard from. But we're going to move on and talk about the Affordable Care Act. So we're going to have a presentation, and then we will open it up to question and answers. Again, if you would be so kind to raise your hand, we will bring you the microphone because everybody will get the benefit of hearing your great question and also learning from the response. Also, just make sure on this piece, we know that there will be a lot of questions, and we ask that you share the airtime. So maybe if you've already asked a question and someone else hasn't, let the other people ask first, but let's share the airtime. But anyway, we're going to move on, and please give Chewon Lee a nice round of applause and welcome him.
Thanks, Cheryl. Can everybody hear me okay? All right, well, welcome back, and thanks for coming back. My name is Chewon Lee. My friends call me Che. And since we are in a group of a room full of friends, please call me Che. I'm very excited to be here, the hometown of the Bulldogs. Is it just me who's excited about this? Yay! All right, all right. So today I'm going to talk about the Affordable Care Act with Carolyn, who you heard from before. And by the way, I'm also a regional trainer for Sheba. And so if you have questions throughout our presentation today, feel free to ask questions. So by a show of hands, can I just ask, how many of you have heard about the Affordable Care Act? Okay. I see some folks who have not raised your hands. What about Obamacare? All right. Or healthcare reform. It's called a lot of different names. So today, we're going to do our best not to talk about politics. There's been so much misinformation, and I heard some chuckles out from the group, but we're going to do our best not to talk politics. There's been a lot of misinformation out there, and our goal today is to ensure that you guys get the right information, and not only for yourselves, but then to share that with others that truly might need to know about these new benefits. In our state alone, we have about 1.1 million uninsured individuals, and many more who are underinsured. So the information that you're going to hear today will apply to a lot of people in the community. So again, you guys are messengers. You guys are going to be the eyes and ears of the community. So please listen up. So first of all, I would like to ask you a question. Take a look. So, which of the following is true? 1, ACA benefits don't begin until 2014. By a show of hands, how many of you think that is true? All right, okay, good. I'm not going to give you the answer till the end. What about number 2? People on Medicare will all have to purchase new or different insurance plans. What do you guys think? True? Anyone? All right, smart group, okay. Number 3, ACA provides free coverage for some preventive benefits and closes the donut hole by 2020. All right, many of you have been listening to Liz and Joanne. That's a good thing. All right, and 4, ACA is not constitutional. Is that a loaded statement or what? So the answer obviously is number 3. Now, there are some of you who've raised your hands to other questions saying that that is true. Let's just touch on those briefly, and then Carolyn will talk more about why these things that I mentioned earlier, for example, 1, 2, and 4, are false. So 1, ACA benefits don't begin until 2014. There are aspects of the law, the big piece, the exchange, that starts in 2014, but today there are a lot of benefits that are already in place. So we'll talk more about those. Secondly, as you know, if you are on Medicare, you do not have to change plans and go into the exchange. Medicare will continue, and you can stay on Medicare. And 4, ACA is not constitutional. Well, June of last year, the Supreme Court ruled that ACA is constitutional. Also, the individual mandate, otherwise known as the penalty or the fine, is constitutional. And third, the expansion of Medicaid, however, now is left up to the states. In our state, the governor has made it clear that he's supporting Medicaid expansion, and it's left up to the legislature to decide what they will do with it. So we're keeping our fingers crossed. So healthcare is very personal, and that's why perhaps it's so contentious. Some people are scared of the changes. Some people don't understand the law, and some people don't like the law. Some people truly like it. The bottom line is we're all here because we want to learn more about it. There are 3 goals of healthcare reform. First is to reduce healthcare spending. Second is to improve access and quality. And third is to enhance patient protections. And we'll talk about all 3 of these in order. Take a look at this. National health expenditures per capita. It's a nice hockey stick going up. If you look at the healthcare costs per capita across the world, the US spends the most amount of money. Yet, when you look at health efficacy, we rank around 37 around the world. So there's a big disparity there between cost and efficacy. So, some people say, I have insurance today, and I am not going to benefit from healthcare reform or the Affordable Care Act. Why should I really care? It's probably just going to cost me more money. Well, that's actually not true. And even if you are insured, today you are paying for the coverage of those who are uninsured. And it's costing the state a lot of money. So, a question here. What does uncompensated care in Washington amount to? 1, 240 million. By show of hands, can I see those who believe that it's 240 million? No one? Okay. How about 425 million? A couple of you? All right. 750 million? Okay. And what about a billion? Okay, about half and half. All right, big rollers. So uncompensated care in Washington is actually $1 billion. And it's costing those who are currently insured more than $1,000 a year for a family of 4. So it's impacting all of us in some way, shape, or form. When you look at the impact that it has on individuals, on an individual basis, these are the kind of things that we're hearing. So take a look. 72% of jobless Americans said they couldn't afford to fill a prescription or obtain needed medical tests. Worse, 40% said that medical bills forced them into difficult financial decisions. And when you talk to those who are personally bankrupt, 60% of individuals attribute that to medical costs. So it's a serious issue impacting us, our families, and friends. And that's why the Affordable Care Act was created in March of 2010. So Carolyn is now going to talk about the specifics of how the ACA impacts you and I.
Okay, can everyone hear me? Can you hear me in the back? Yes. Okay, great. Well, what does this mean for me? What does it mean for you? Our neighbors, our family, our friends? And as far as Medicare is concerned, the Affordable Care Act does not cut Medicare benefits. I know 6 months to a year ago, we heard a lot about the cuts to Medicare, and that was pretty scary to most beneficiaries. It does not eliminate Medicare Advantage plans. There's some provision within the Affordable Care Act that reduces the number of plans, Advantage plans that are available on the market, but it doesn't eliminate them or prohibit them in any way. It does not require people with Medicare to get different insurance. When we talk about the Affordable Care Act, again, as Chase said, we're talking about primarily people who are either uninsured or underinsured. That means they have some type of coverage, but it doesn't necessarily pay a whole lot. So hospitals and doctors don't really get full payment for the services that they provide. Obamacare or the ACA does not require Medicare enrollees to make any changes. It does, however, improve Medicare benefits, and it does reduce Medicare cost. I want to go back to the statement that was made earlier, and that is, we've heard a lot about the cuts in Medicare. There are cuts, but not to all of the enrollees or the beneficiaries. The cuts to Medicare occur in the payments that are going to providers. And those cuts are actually going to be paid for by greater efficiency within the Medicare system. Okay, the good thing is you don't have to wait until 2014 to enjoy some of the benefits of the Affordable Care Act. There are increased preventive benefits, which is a good thing, and we may not see as a nation a lot of savings in the first few years, but over a period of time, that's when prevention will really pay off. There's also the discounts in the donut hole, and by 2020, that's going to be closed up. I know someone earlier today kind of laughed or chuckled when the donut hole was mentioned. It just means that you reach a certain amount of money that you've paid and your drug plan has paid for your prescription drug costs. You reach the donut hole, and guess what? You start to pay more out of your own pocket. And the Affordable Care Act does slowly eliminate this over a period of time. My understanding that in 2012, the average savings for each Medicare beneficiary because of the ACA was about $600. That was the average savings across the country. Okay, the provisions of the ACA, again, part of the revenue that's generated through savings, reductions in cost. The hospital readmissions, there's a major problem that we have in this country, and that is many people who are hospitalized, they're dismissed or released, and then they go home, and they may unknowingly and unfortunately have acquired some kind of an infection during their hospital stay. Well, Medicare has now told providers that, you know, if this happens at a high rate for your patients, we're not going to pay you all of the reimbursement or payment that you're expecting because you need to do something to control the hospital-acquired infection. So that's one of the other benefits of the ACA. There's new authority and a greater focus on reducing fraud and abuse. In fact, SHEBA here in Washington hosts the Senior Medicare Patrol, which is an entity or an effort that really tries to not only detect fraud, but prevent it and then also report it. And so far, just since the enactment of the Affordable Care Act, we have seen quite good results from this increased effort or focus on preventing fraud. And then, again, it's expected to save billions of dollars. What about the ACA for people not on Medicare? As I said before, really the focus of the Affordable Care Act is targeted toward the uninsured or the underinsured. And some of the good provisions that actually started back in 2010, in the fall of 2010, after the bill was signed into law, is that children could not be denied any kind of coverage due to a pre-existing condition. Well, the good thing is that beginning in 2014, adults cannot be denied coverage by an insurer if you have a pre-existing condition. That's worth quite a bit. It also allows parents to keep their children, their adult children, on their own, on their own policy up to age 26. And it's somewhat lenient because you may have a child who's 25. Maybe that child doesn't live at home or doesn't live with you. Maybe that child is not going to school. Maybe that child is already working. He or she may still be carried on your policy. That's big for a lot of parents across the country. There's no cap on lifetime limits. This is one of the problems that many Americans faced, and they would have an unfortunate illness or an accident only to find out that their policy, their health insurance policy, said, okay, we'll cover everything up to $1 million a year, and then you're on your own. So the Affordable Care Act stops that practice. So there are no lifetime limits and there are no annual limits. It's a good thing. There's no out-of-pocket costs for preventive care. And this is something that's also new. With the Affordable Care Act, if you're an insurer, I'm an insurance plan, then I have to make sure to comply with the law that all of the money I take in, because you're paying premiums to me for your coverage, I am required to use either 85% or 80% of those premium dollars to spend on your care. That was not the case before the Affordable Care Act. We talk about the exchange. I think it's described as the heart of the Affordable Care Act is this new exchange. And that is nothing more than a new online marketplace where consumers can go and shop for health care coverage. And there are a lot of advantages to having an exchange. Washington State will have its own exchange. It will be a state-operated exchange. All of the plans that are offered for sale on the exchange must cover 10 essential benefits. They all have to cover these 10 essential benefits. It could be hospitalization, it could be emergency care. What are some others, Che?
Prescription drugs.
Prescription drugs. Mental health, maternity care, et cetera. So they all have to cover these 10 essential services. There was a lot of misinformation when the debate was underway, and that is, well, what happens if I don't want to get health insurance? I'm healthy, I don't need it. I should not be forced to buy health insurance. It's expensive. Well, the rumor was going around that if you did not buy a health insurance or you could not prove that you had coverage beginning January 1 of 2014, you'd go to jail. That's not true. Not true at all. You will, however, have to pay a penalty, a fee, a fine, an assessment. You can call it whatever you want, but you'll have to pay it if you don't have insurance coverage. The first year, I just decided I'm just not going to do it. I'm healthy. So that first year when I file my tax return, they will deduct $95 or they will assess me $95. And I think, well, that's not too bad. You know, if I'd bought health insurance, it might have cost me $1,000, $5,000, it varies. So $95 looks rather affordable. However, the problem is if I go several years without insurance, that $95 goes up and up and up until it eventually becomes 2% of your income. So that by that time I'm thinking, I'm paying all of this as a fee or a penalty. I might as well get health coverage because at least I'd have peace of mind and I would have access to doctors and hospitals. I see a question in the back.
This only applies to people who do not have Medicare or do not have insurance through their employment, is that correct?
I did not hear.
Yeah, so the question is, does the penalty only apply to those?
So does this whole information, all of this
I have a microphone, hold on.
Sorry, why don't you repeat the question?
My question is, all of this information about the Affordable Health Care Act only applies to people who do not have Medicare and who do not have employment through their do not have insurance through their employment. Is that correct?
Yes to the first part, no to the other, and I think we'll explain here in a few minutes. There are many people today who are working and they have employer coverage. The problem is it may not be very good coverage. And so the Affordable Care Act sets certain standards, and that standard is an easy one to remember. That employer plan must cover at least 60% of the cost of your services. If it only covers 50%, it's not good enough. So,
And if I may just expand upon that answer, the question was, if you have Medicare or if you have an employer-covered plan, does all of this, ACA, not impact you? It's partially true, but it's partially false. And the reason is this. As we talk about the ACA throughout today's session, as you've already heard, there is an element of it, which is a big part of it, which is the exchange, a new marketplace for those without insurance today who are able to get insurance in 2014. That, of course, applies to those who are under 65, not yet on Medicare, without insurance, right? But for those who have Medicare and for those who have employer coverage, there are aspects of the law, mostly consumer protection measures, that apply to you. For instance, as Carolyn talked about, preventive care for Medicare beneficiaries has now become, for the most part, free, where you don't have to pay a copay. So you have Medicare, and the ACA is impacting you in a positive way. So think of it that way. It's not just about expanding coverage to those without insurance, but even with those with insurance can get some benefits through the ACA.
thank you. Okay. At least 800,000 Washingtonians will be eligible to use the exchange. That means that they are in a situation where they can go to this new website and shop for and compare different plans and even enroll in one that meets their needs. You know, there was a lot of argument about whether or not it's really necessary for Americans to have health care insurance. Well, it's kind of odd because I think we're all accustomed to being required to have liability insurance for driving. Well, health care coverage is pretty much in that same vein. It's something you need before you need it. You need it in case of an emergency. And you don't wait until after the fact to get it, because if you did, none of us could afford it. So that is why the individual mandate is part of the ACA. Okay.
Thanks, Carolyn. So I have a 6-year-old son, and when he was, or before he was born, my wife told me, you got to paint the wall. And I was thinking about what color to paint my wall, or my son's wall, and if you haven't noticed, I'm kind of partial to blue, like my socks are blue. So I went to Home Depot and I looked for a blue color paint, and I got like 50 different shades of blue to choose from. And this is the kind of issue that we face today, or folks who are comparing insurance options face today in the private market. There are so many plans with different benefits, different premiums, different co-pays, co-insurance, different exclusions. So it's difficult to compare apples to apples and oranges to oranges. What the new marketplace does, the exchange does, is it allows for people to compare plans based on quality, price, and service. So we'll talk a little bit more about the essential health benefits and also talk about the different tiers, but it makes things much easier for folks. To share a little bit more about the exchange, it is governed by an independent board. It is a quasi-government, it's a public-private partnership. And there are currently 11 people elected to be on the board. 2 are ex officio non-voting members. One is the Insurance Commissioner Kreidler. The other one is the head of Healthcare Authority. And then other members of the board are selected from the community. There are college professors on healthcare financing, folks from the provider community, folks from the insurance community. So that board dictates how to implement the exchange in our state. One more thing, the enrollment for the exchange. Here it says October 15th, but it really starts the 1st of October, and it goes until the end of March. And when you sign up in October, for those of you who will be signing up for the exchange, again, if you're on Medicare, there is no need to sign up for this. But for those of you who will be signing up, the benefit will begin in January. So in our state, again, just briefly, we have decided to implement the exchange as a state. There are 18 states across the country that have decided to do so. Other states have a different format. There are some states that are partnering with the Health and Human Services, with the feds, for a joint exchange program, and some states that have simply defaulted to Health and Human Services to operate a federal exchange. And then along with this, there's the expansion of Medicaid, which Carolyn will talk about a bit more later, but that too is a state-based decision, as we have talked about in the beginning of today's presentation. In our state, again, we think that we will go forward with the expansion. We'll have to see. And some other states, at least the governors of other states, have more and more been saying that they will be going forward with the exchange or the expansion of Medicaid. So that's something to look to if you are interested in this topic. So the exchange in our state is officially now called the Washington Health Plan Finder. And this is the logo at the bottom. And what it allows for you to do is you go online and you first find out if you're eligible for a qualified health plan. And these health plans will be applying to become qualified health plans through our office, the Insurance Commissioner's office. And we will know by the middle or the end of the summer which plans are then approved to offer their plans in this new marketplace. And then online at that site, you will also be able to find out if you qualify for a subsidy to help pay for these plans, or if you qualify for Medicaid to not pay anything to get health care coverage. And then you can compare plans, again, apples to apples and oranges to oranges, and then choose a plan and enroll. And that's how this online website, again called the Washington Health Plan Finder, will help you. This is a screenshot of what the Health Plan Finder may look like. And this is a graphic to show you, to illustrate for those of you who are more visual in your learning style, to walk you through how this all works. So again, you first apply for coverage over the phone or online, and then you see whether or not you qualify for subsidies or for Medicaid, and then you choose from one of these 4 tiered plans. There's platinum, gold, silver, and bronze, and I will show you how that breaks out, and then you compare among those plans, and then you enroll. So let's take a look at how this all works. So there are 4 main tiers for most individuals between the ages of 30 to 65. Again, if you become 65, most of us are eligible for Medicare, so we're looking at the population between 30 to about 64 years of age. Those folks will have to choose from one of these 4 plans. So Platinum is most generous, meaning that you only pay generally 10% in coinsurance, and the plan pays 90%. And there's not just one plan in the Platinum tier. In each tier, there will be qualified health plans, choices for you to choose from. If you go to the Bronze plan, you'll pay 40%, and then the plan will pay 60% on your behalf. And the premiums will most likely be lower than, of course, the Platinum plan. So higher premium, lower coinsurance, lower premium, higher coinsurance. In each tier, there will be plans offered where you can compare them side by side. And the other question that you might have is, what about the benefits? Again, there are essential health benefits built into all of these plans to ensure that they have a minimum benchmark or baseline of benefits that will be provided no matter which tier you go to. Now, for those folks who are under the age of 30, so young adults, we also call them the invincibles. These days, the term boomerangers are becoming more popular, but these folks can get catastrophic plans, higher deductible plans, to allow for them to purchase plans at a lower cost. And because most likely they're healthier, we want to make sure that they come into the marketplace and be able to get these plans. So Carolyn's going to walk us through how you can get subsidies or how you can get Medicaid in 2014.
Okay, this is a chart. I do a better job if I just explain it, but right now, in the state of Washington, to be eligible for Medicaid, you have to have income at 100% or below the federal poverty level. With the Affordable Care Act, that 100% is going to go up to 138%. And what we know, looking at the demographics of our state, is where a lot of the uninsured will fall into place or right into that range of income, which means that those who've never been eligible for Medicaid beginning in 2014 will be eligible as long as their income is at or below 138%. But if you make more than that, say your income is at 160% or 300%, there's help available for you as well. And that's what we refer to as the premium credits or the premium subsidies, premium assistance. What that means is that there is help available for the people between 139 up to 400% of the federal poverty level. They will get money, or their insurer will get money on their behalf to enroll in a plan. And it's actually very generous, and that higher income for an individual, say at 400%, is about $46,000 a year. And then if you have children, a spouse, then that income level will increase accordingly. So if you're closer to that 138% cutoff, your subsidy is going to be a little bit more than if you made close to the upper limit, the 400%, you'll be getting less. So it's a range of assistance. But it's actually, these subsidies are quite generous. And when the exchange opens for business October 1 of this year, I think people are going to be pleasantly surprised that the subsidies are generous. We talked a little bit about the essential benefits. I'm so glad we have this slide because sometimes my memory just flows out. But pediatric services, prescription drugs, laboratory services, and so on, these are all listed. And Che mentioned that there are different types of plans. There's a platinum, a gold, a silver, a bronze. What that means is that all of those plans will cover these services. However, the distinction is that if you are in a platinum, if you select a platinum, again, the most expensive plan, that plan will cover 90% of these benefits. If you're in a bronze plan at the very bottom, that plan will cover 60% of these services or benefits. Is that clear? Okay. Okay, how can you access the new website, the Washington Plan Finder? It's very easy. You go online, you can use your own computer, you can go to the public library and log on and kind of explore it on your own. Or you may call, we're going to have a customer call center, I believe, right here in Spokane. You'll call that toll-free number and you'll get a live person, and you answer just a couple of questions and they will then help you begin going through or exploring the website. Or if you don't have a computer, maybe you live in a remote area and you depend on mail, you can mail a letter asking for help, you can fax, or you can send an email. So access to the website is very varied, quite varied. Okay, we've heard this term navigators. A navigator is simply a person, much like our SHIBA volunteers, who have to undergo training. They have to take an exam and pass it. They have to learn good customer service skills. And they have to know quite a bit about health care insurance. And then they will be certified as navigators. And these navigators are the individuals who are going to be scattered throughout the state and will answer consumers' questions. They can't tell consumers which plan to buy, but they can show you all of the plans that might meet your needs, and then the consumer, you will actually pick out the plan. They also are going to be out in the communities talking about the exchange. So outreach and education is a huge part of what a navigator will do. And also refer consumers to the right agency. Maybe you're turning 65 and you're about ready to enroll in Medicare. Well, they'll probably refer you to Medicare or to SHIBA. So there'll be a lot of referrals going on beginning in October. Okay, question and answers. Yes.